I know, but good afternoon, everybody. This meeting of the Allegheny County Jail Oversight Board is called to order. I'm just going to ask everybody to identify themselves in line for attendance, please.
Yep, Barbara Griffin. Kelly Bigley.
Kevin Kraus.
Corey O'Connor.
Sarah Namarato.
Susan Ibashevik.
Rob Perkins.
Bethany Hallam.
Manny.
Okay, thank you. I did want to defer to the warden for a minute before we got started, who wanted to make a couple of comments about the incident at the jail.
Yeah, thank you, Your Honor. Just wanted to report, on March 7th, we had a death in the facility. And I wanted to make everyone aware that we immediately notified the board. We had that correspondence, and then I think a day or two later, we met with the board. We don't have the final report back from the ME's office. When we have that, we're going to ask for another meeting with the board to discuss that final report. In the meantime, we've had several after-action meetings. We're continuing to look at that whole entire timeline and everything and figuring out ways to improve if we could have. So I just wanted to let the board know that. Obviously, it's very sad to have to report that, but I want to let you know that, we'll request a final report or request another meeting with you when we had the final report. Thank you.
Warden, I just wanted to thank you for the transparency that your administration had with us about this recent death. I have been on this board for 5 years now and got more information out of that one single meeting that we had, again, very quick after the death occurred, than I ever got in all of the deaths that unfortunately happened in the past 5 years. So I really look forward to that follow-up, but I just didn't want this time to go past without letting you know how much that meant to us to be able to actually hear it in real time and strategize to address to prevent another death from happening in the future. So thank you for that, and all of you.
You're welcome.
I appreciate it very much.
We all appreciate the job that you're doing. I know I speak for every board member up here that you are keeping us informed, giving us information, easily accessible, and we really, really appreciate it. Okay, community corrections reports, passages to recovery.
Good evening, Board. Greg Price, Director of Operations for Passage to Recovery. Our current DOC count is 23 active clients. For the month of March, we had 3 escapes, 1 revocation. We had 0 non-fatal and fatal overdoses, of course. We also appreciate the warden and his team for coming out last week to Passages to help us continue on with the therapeutic approach and accountability approach for the jail and for Passages to Recovery. We also had 1 revocation, I believe, and that was it. Any questions?
Questions? Ms. Hallam?
Yeah, I have a question. I know we've been seeing an outbreak. I think Erie was the closest where we've seen it of measles. And so I'm wondering, I know with COVID shots, and we're doing a pretty great job with those, but one, I just wanted an update, and I'm going to ask all of the facilities about this, but are we screening or giving MMR vaccinations, and also are we keeping COVID vaccinations up to date?
We are keeping COVID vaccinations up to date. We didn't have one. We had one in February, but not this month. But yes, we are screening upon intake from the jail as well.
Okay, for MMR as well as COVID? Okay, and are you offering that to people who maybe don't have that vaccination? Okay.
Yes.
All right, thank you very much.
Of course. Any other questions?
Not a question, but a comment. We were a little late to the last meeting, so I didn't get a chance to say this. But since the last time we spoke, I visited your facility again, dropping off a package for a friend. Every time I go in there, it's a lot of love, it's a lot of respect. I feel a lot of positive energy, so just want to thank you for that. Say keep up the good work.
I appreciate it. Thank you. Thank you, Board. Good evening.
I just have one further question. How many open beds do you have?
We hold a total of 56 total. So we have currently 23, but we have a total of 29 residents because we have some self-admit residents as well. I'm sorry, 28. So we have a total of 28 and 28 is 56. Yep.
So 56 total beds and only 26 are filled?
28 is filled.
Okay.
Yep.
So that is 28 empty ones.
Yes,
Okay.
28, 28.
So it's half full?
Yes.
Okay, great, thank you.
Thank you.
Renewal.
Good afternoon, Adam Zach, Case Manager Supervisor reporting for renewal. We currently have 114 active clients in our program. The breakdown is 82 individuals in our work release program, 66 males, 16 females, 32 in our drug and alcohol program, 27 males and 5 females. Last month, we had 11 program walkaways or failure to returns. We had 12 returns to the Allegheny County Jail, and we had 35 successful completions. Also last month, we had 2 occurrences where the EMTs were called to our buildings, one for stomach pain, one for chest pain. We had 0 deaths or suicides, 0 non-fatal overdoses. We had 1 reported self-harm incident. In the next several months, there will be quite a few reentry and job fairs the men and women will be attending. I'm sure we'll be reporting on those in future meetings.
Questions? Ms. Hallam?
Yes, same question about COVID vaccines. Are you keeping those up to date? And then also, are you screening and/or administering MMR?
For staff, they're up to date, so
On MMR and COVID?
COVID,
COVID, okay. What about the incarcerated individuals?
no.
No, okay, so if somebody wanted a COVID shot in renewal, how would they get it?
We would go to outside agency, pharmacy.
Okay, and then what about screening for MMR for the incarcerated individuals?
I don't believe so.
Okay, thank you very much. Oh, and last thing, how many open beds do you guys have?
I don't have a number for you. We have a lot of open beds.
Okay,
We have a lot.
how many total beds do you have across the facility? Do you know that?
Approximately like 140.
140.
Approximately.
And you have, did you say 114 participants?
Yes.
Okay, so,
I could get a specific number for you next month, or sooner than that, actually.
but at least 26.
We contract
Yes.
with renewal for 180 beds, 30 females, 150 males.
Thank you so much. And there's 114. Okay, so that is 66. Thank you very, very much, and thank you.
Anybody else? Thank you. Electronic monitoring.
Good evening, Board. Steve S. Wine for the Probation Office. For this reporting period, we had 569 people on the bracelet at the end of the month. 82 were successfully completed. We did have 5 that were returned to the jail for violations and new arrests. So, any questions?
I feel like that's a lower number of returns than we have heard in the past.
It's a little bit less, yeah.
Okay, so,
Some months are good, some months are crazy.
well, that was
But
a good
this
one.
It was a good month.
Great, thank you.
Thank you.
Thank you. All right, 3 people signed up to speak on the new business, specifically motion to remove the grievance process from the tablets back to the carbon copy paper form. So I'm going to call your names. If you actually want to speak on that issue, you may speak now. Tanisha Long.
What I was going to say is that Tim Stevens needs to move to the other list. I just screwed it up signing him up.
Okay, what about you?
Yeah,
You, okay.
I just screwed it up, and you know, I said what I need to say.
All right. Good evening, Board. Tanisha Long, Abolitionist Law Center. First and foremost, I want to say that I do support Bethany Hallam's motion to move the grievances from the tablet to the paper form. One of the reasons that I feel this is very important is because people are not walking out with a copy of their grievances, so they're not being provided one for their own records. So when something happens to them and they come to places like us, they have no proof it's happened to them, and then we have to go through a pretty arduous process with the jail to get copies of those grievances. So for people who are, one, just want to keep an account of the things that happen to them, because that's important, they don't have that. So, I think we should move it back to paper. One thing I do want to point out is we have to make sure we have those on every pod, because that's not always the case. And also, a lot of people don't have access to tablets. Even though I know the jail's getting way better at that, it's just where we're at right now. That being said, I will now switch to other things that I want to speak out. We were made aware that someone was taken from the Renewal Center by ICE. One, I want to say that I had never imagined myself in a situation where we had a warden who actually like cared about stuff. And I know that's not important, but if you are willing to, there are groups who would like to talk to you about procedures surrounding how to interact with ICE. So, you know, if you're open to that, that's something that's very important to us, is making sure that people aren't getting kidnapped. It happens in the courts, it happens in renewal, it happens in the jail. One of the things we'd like to speak to you is process and procedures around releases and how we can make that a less harmful situation. I have a lot of undocumented friends and neighbors, and I would never want to see them in a situation where they were afraid that they would not be able to, you know, like if they left one of those situations, that they would be leaving the country as well. So it's super important to me. And then finally, the thing I wanted to speak on was retaliation. A lot of friends and family members are coming up here to speak to you, and a lot of them are taking a risk by specifically mentioning their loved ones' names. And what's happening, and what we're hearing directly from the incarcerated people, even within the last 2 jail oversight board meetings, is that you do the work to fix things, and that is phenomenal. We've never had that before. But what also ends up happening is COs and even sergeants then go to those incarcerated people and make comments. They do things that are actually harmful. We've had, you know, things like the removal of a medical mattress after someone's loved one spoke about their medical care. People being fired as pod workers. There's a lot going on. So I just want to make sure we are creating the environment in the jail where people aren't afraid to speak out about the things that are happening to them, and where their family members are not then afraid to speak out on what's happening to their loved ones. And I know it's going to take a long time to get that culture shift to happen, but you can't start the process if you don't know what's happening, and that is happening. People are being retaliated against. So just something to look at. Thank you.
Thank you. Tina Samilovich.
Okay. Sorry, guys, I'm nervous. I want to support Councilwoman Harlem's motion for paper grievances. My fiance, Raymond Fields, had been incarcerated for 16 months. Never had he had a health issue or a psych issue. About 3 months ago, the jail had put him on Ozempic, a weight loss drug for diabetics. Started him off on a dose of 0.25, and on March 5th, upped it to 0.50. Ever since he started receiving the shot, he had been having minor side effects that nurses said would go away. On March 10th, he had not been feeling well, tried waking him up for an hour, kicking him multiple times until he finally came to it. They took him to the medical floor on 5. When he called, he was wigging out, saying, "These people are trying to kill me, and I don't know what's wrong. I can't hold anything. I have the tremors, and I think I'm hallucinating." I'm hallucinating, and was screaming on the phone that he was going to die and needed help. The next day, he had tremors so badly that he tripped over the toilet in the middle of the night and busted his face and got 2 black eyes and a broken foot. He cried and begged for help, and nurses and COs just laughed at him for 3 days as he cried and as he laid on the floor in his own urine and throw up. The following day, they wanted to send him back to the regular floor, but he refused, claiming, "Something is wrong with me, please help." Hadn't eaten in multiple days by this point, and certain nurses told him he was faking it and that he was smoking K2. After multiple urine samples and blood tests that were negative, they insisted that he was high and faking it. On the 3rd day, his symptoms were worse, and he had still not seen a doctor after the 3rd day since he arrived there. I contacted Bethany about the issue, and finally, after 3 days of crying and begging on his door for help to see a doctor, on the 3rd night at 4 a.m., a doctor finally came in and gave him a look and said, "Call an ambulance right away. He needs to get to the ER." Upon arrival at AGH, the doctor said, "Why in the world wasn't he brought down here days ago? His kidneys aren't working and it's shut down. His one lung has collapsed due to the amount of fluid in it, and the tremors he were having were actual seizures, and he was slipping in and out of a coma." The doctor told him one more day that he would have been dead. His foot was severely broken, and he now has a boot on it. They kept him there for a week and said that his medications, the jail had him on 20 different medications a day, and his levels should be checked often, and they were not. I want an investigation into this issue, how this can get so unnoticed by so many different so-called professionals. I want to make sure his health is a priority to them so that doesn't happen again to him or anybody else. He could have died had it been another day ignored. And I would like someone from the jail to contact me to discuss this, please. Thank you.
Okay. That your comments were not on the board action, so I would.
Yeah, she commented about the grievances. She's in support of the grievances. It was the first thing she said.
Oh, and then
He felt like I couldn't understand me because I was nervous.
Okay, do I have a motion to approve the March 6, 25 meeting minutes?
So moved.
Second. All in favor? Aye. Any opposed? Motion carries. Let's go to new business, because I believe Mr. O'Connor has an engagement. Okay.
Yeah, that's good.
Well, we'll do it anyway. New business.
Can we read it?
Thank you, Judge. This is a motion to remove the grievance process from the tablets back to the carbon copy paper forms. This is something that has been brought up, I mean, literally for years now by incarcerated individuals. For folks who are newer to the board, all of the requests, sick calls, grievances, everything like that, used to be done on paper forms. They were carbon copy forms so that you could fill it out, submit one, and then keep one for your own records to track when it gets responded to take with you when you leave, to reference while you're in your cell or when you're in a situation where you don't have a tablet. When we got the tablets, all of those requests were moved to the tablets, and the paper forms were all but eliminated. And then, because everything was on the tablets, the paper forms were rarely stocked on the pod. So when we would go on our inspections and check the pod, there were no paper forms for people to fill out, and they were often complaining about that. I know that the warden wants to speak about this. It's something that he and I have worked on together, something that he had wanted and something that I wanted. So in the spirit of the collaboration with this new jail administration, if it's okay with you, Judge, before we vote or have discussion, I would like to ask the warden to speak on why he is in favor of this. Is that okay?
You wish to speak?
And that's fine, Your Honor.
Go ahead.
I think we're at a place where we can divide all this up to, essentially, if you're incarcerated there, you can file a request. So, let's just say you want a cell move, you file a request. You can file a form to the JOB, that's a separate box, or you can file a grievance. I think some of the confusion in the last couple of years was using the word complaint. There's supposed to be three separate things here. It's supposed to be a simple request about anything to a unit manager or captain or to me, and then there is something to the board, and then there's a grievance. What we want to do, and I agree with what you said, this will allow us to track better. It'll allow us to keep records in our office. This will allow us to look at trends. This will allow us to see the mood of the facility. So if we receive 100 grievances in a month, we can then go and say we're 80 of them based on food, or 60 of them based on experiences with staff. We then can, over time, track the mood or the trends in the facility a lot better than we can now. So I think it's advantageous, and for reasons you mentioned, it gives copies to everybody involved, but we will bring them into our office. We will record them. We will assign them to be responded to within a certain amount of time, and then we will track those responses, and the incarcerated person will get a copy. I think it makes sense. It seems a little awkward to go to paper in 2025, but in this particular case, it will allow us to track things a lot better, in my belief.
Thank you. And with that, I would ask for a second to the motion.
Second. All in favor?
Do we want to have discussion? Or no?
Oh,
Okay.
is
All
there
right.
discussion? Sorry. Does anybody want?
I just, about the
I
kind of.
apologize.
Yeah, that's okay. So the different types of complaints, grievance, is that going to be all on one form, or are there going to be different forms for each type of?
So a grievance form will have different categories. You can file a grievance on the food. You can file a grievance on, we'll have areas, but it will be one form with carbon copies. I call them snap sets. That's just an old term. Several of us are very familiar with this system. It's been tested through the years. It does work. I mean, we talked before, full disclosure, the issue is making sure that we have accessibility to these forms, and that's precisely why when we talk later about unit management and some other things we're doing down there, the accessibility to the form is obviously paramount, and we're putting other processes in place to make sure the forms are available. And we don't hit the mark every time, but we're working on that every day.
So you're going to.
Yes, there will be, there'll be a simple request form. There'll be a form to you all that they can fill out that will be picked up and brought directly, won't come to me. And then there'll be a grievance form. We're moving away from complaints.
Okay, so that's like 3 forms, basically, that you're talking about?
Yes, ma'am.
And then, are you going to discuss later about how those are going to be made available and what you're, okay.
Yeah.
All right, thanks.
Anybody else?
Just one point. I know when we were discussing this motion, Warden, you had talked about using the tablet system for education about what these various forms are and like what category to choose. Can you speak about that a little bit, please?
Sure. Part of the confusion and probably why you said it's been going on for years is, saying I want a cell move is a request. It's not a grievance. So what we want to use the tablets to educate the population about this is a request, this is something you should file to the JOB, here's how you do that, and here's how you file a grievance. These are the categories of what a grievance is. And we're going to continue to blast that onto the tablets and educate about exactly how those categories work. And it's going to take a little time because we have to put all the boxes on the units. We have to get all these I brought a form with me. I have to get all these copies made, all the carbon copies. So it'll take a little time. We'll keep you updated, but we just think it's the best way to proceed forward. And our staff on our units, including unit managers, are going to educate also about when you need to file. What we're seeing now is it's filed on a tablet. It's put on 3 different boxes. It's actually creating more work for everybody because you file 3 pieces of paper saying I want a cell move. We need to educate everybody on exactly how you do that. So we're going to use the tablets to do that.
Awesome.
Partially.
And then can I just make a request that you label the boxes? I know when I see the secret box now, you have no idea what it is unless you know.
Yes.
Okay. All right. Thank you. So
How will the JOB complaints or requests get to us?
the liaison. It's the liaison
Okay, the
forms.
liaison will
Yes,
get
now.
to- Okay, all right, anybody else?
Yes, I actually have a question. I know you said that moving to the paper and the carbon copy will improve tracking. Can you go into a little bit more detail about how it will be tracked?
Sure. So let's just say tonight somebody says, I've tried for weeks to get my tooth fixed, and I'm now filing agreements. Those boxes will be retrieved every day, and they'll come down to our office, administrative wing. We will have someone go through them, like an executive assistant or a warden's assistant. We'll go through those, categorize those, make sure that they went to the appropriate box. They will be a carbon copy. Copy will go back to the individual, and then we're going to put them in a tracking system, a date stamp tracking system, electronic tracking system, and then they will be assigned to a manager, and then we will have the date when it's due back to the incarcerated person with a copy to my office saying exactly what happened. So it's pretty short timelines. We're not talking about when you file something, we don't have a month to file it. I think we're 10 or 15 days, and then we'll have a record of it. And I go to visit someone at his or her cell, they can hold that up and show it to me, and I can say, yeah, we properly addressed that, or I think we should have looked a little further into that.
I got you. Thank you. You also mentioned it's a way to observe trends. I guess I'm a little bit curious about that. So, like, I know, the example you just gave is about somebody, having a dental issue. But, of course, one of our main concerns is people having issues with staff members. If you identify specific trends, exactly how do you plan on addressing that? Or is that something that,
Sure. So
you cross when you get
once we start this, then we will be able to fairly quickly look. Let's just use 100. Say we get 100 grievances in May. We can easily tell what the majority of those were filed about. Was it a medical issue? Was it a food issue? Was it it's freezing in my cell issue? Those kind of issues. And we can start, reacting and trying to get proactive about how we can reduce those numbers based on what we're seeing. I call it the mood of the facility, or the trends that are happening. If all of a sudden I get 9 grievances on the same day about the food, I may not know that for a couple weeks without this system in place, where, now I'm going to almost know in real time that we got inundated last night with a bunch of grievances about something going on in the facility, and then we can respond to that. It allows the administration, in my opinion, to have a better, feel the pulse of what's going on in the facility regarding what's coming in as a grievance. Right now, it's a complaint, it's a request slip, it's signed on a tablet. It's a little confusing to a lot of people.
I got you. My last question is, will the JOB have access to the database or tracking system whenever that's in place?
I have no issue with that.
I have a question. So with respect to the database, is it going to be like a software program, like an Excel spreadsheet? I'm just trying to like visualize like how you're going to capture the data electronically.
Well, I am familiar with the software program. I probably can't borrow that from my last tour of duty, but
Yeah.
we can start it with what you just said, spreadsheet, and then we can look into a program that we can all share. And it'll be live data.
And to give your administration credit, I know with respect to the liaison forms, there was an issue where we would get them not in a timely fashion for some time, but since you've taken over, I know that I think you have someone on your administrative team daily go through and pick up the liaison forms, and now we know we're getting them in a timely fashion. That's extremely helpful, so thank you.
You're welcome.
Okay, are we ready to vote?
Yes, please.
All in favor? Aye.
Aye.
Any opposed? Passes unanimously. Okay, old business. Updates from Employee Welfare Committee. We scheduled 2 exit interviews this month. Only 1 person appeared, but it was very enlightening and very productive, and we met with the warden and shared the results of the exit interview with him, and he was very receptive, and I think there's going to be a few ideas to improve the culture among the employees of the jail. We also met with the warden about the FMLA issue, and we are trying to help the jail administration with somehow alleviating the excessive use of FMLA. Do you want to add anything?
I think you covered everything. I mean, these are complex issues. I have full confidence in the administration, everything they're doing to both make it a better place to work for people who work there, but also, issues with FMLA. That's something that predates this administration by a decade, perhaps. And I pinch myself sometimes thinking like how lucky we are to have you here, Warden, and have this administration who's taking everything seriously, being transparent, doing everything we could ask of you. I like the collaborative approach. I would say I think I spent the entire week talking about jail oversight board issues. So the board has been. So we are working hard to collaborate and problem solve together. So thank you.
Do you have a question?
Yeah, I just have a question about, I guess, how you're compiling the information. So if you could just talk about that process a little bit, like, is it the members of the Employee Welfare Committee who just come and like take notes? Like, is there a report generated at the end, or how are you compiling the information that you get?
We have not compiled it.
How could I, as a non-Employee Welfare Committee member, find out about it? Because that's something that I used to do prior to these committees being in place, and so how could I find out about it?
Well, we could, I don't want to put the job on anybody
Right,
to
me neither.
like type our notes, but certainly we'll
Just call
talk to
me.
you.
Yeah, so is there a point person that I should call to be like, hey, you did an exit interview, can you tell me about it? What did we learn?
me.
Call you, okay, I can do that. Thank you, Judge.
Okay, thank you. Incarceree Welfare Committee update.
I'll be quick. Yeah, sorry. So we did have a meeting with the warden on language access, so I want to thank him and his administration for doing it, and the deputy warden. They had talked about it, so things are moving, and we'll just keep everybody up to date, but it sounds like everybody's in agreement that this has to happen, so I just want to thank everybody for that.
I want to add, and I'm probably stealing the warden's report, but this is germane to the Employee Welfare Committee and the Incarceree Welfare Committee, because the TAILS program is going to be starting very soon, teaching animals in incarcerees lifelong skills. And just so, I don't want to, you could, I know, but I'm so excited about it. There's going to be 2 dogs who are going to be living at the jail, okay, to start, but it can go up to a maximum of 6, and they're going to live there.
Where are they going to be?
Fake AstroTurf.
Like at the airports.
Yeah.
Can't
But
wait.
they're going to be able to be fostered by jail employees so that they could go out for walks, they could, you know, maybe go home for a weekend. Yes, yes. Okay, I'll be quiet.
Great.
Okay, Health Services Advisory Committee.
I was going to just jump in on the incarcerated
Oh,
person
sorry,
welfare
I'm sorry.
subcommittee too, but the controller covered it already. But I would say that again, it's an example. Deputy Warden Clark met with us for a significant period of time. The jail's already doing a lot in that space to improve language access. I know that they're committed to it, but I would just say Controller O'Connor's office did do a ton of homework with respect to looking at what plans are there throughout the state, throughout the country. The truth is there's not many plans out there, and a lot of jails haven't been leaders in setting precedents. So in some ways, we'll be innovators, but we have the right attitude and right approach to that. I think Philadelphia does have some written plan. I think ours will be better because Pittsburgh is better than Philadelphia. So, thank you.
Okay, sorry about that, Mr. Perkins. Health Services Advisory Committee.
I'll give
You're on everything.
I'll give a quick update. I don't want to preempt Deputy Warden Martin's presentation because I think there's a lot of really exciting success as far as what the healthcare staff is doing. We're actually meeting tomorrow with respect to our subcommittee, and then we're going to meet separately with the healthcare administrative team later this month. There's several successful initiatives that are, again, unprecedented and really something to be proud of. So I'll let the jail talk about that. The one thing I would just mention is that we're trying to prioritize what is the most important issue, where can we, devote our resources to make the most impact. And we're focused right now on healthcare and intake. And I know we've discussed this before, but I think the point bears repeating that there might be one of the most challenging tasks or responsibilities of any job in America is to deal with health care for people who've just been arrested, who may be struggling with substance use treatment, maybe having a mental health emergency. We don't know anything about this person. We don't know what their comorbidities are. It's an extremely hard job, and it's essentially an emergency room within the jail, and with security concerns and everything else, it's an unbelievable challenge. I think that this administration is up to that challenge, and we're going to keep on talking about the improvements made and thinking about other ways to improve moving forward.
Thank you. Lockdown and Use of Force Committee.
All right, update from the Use of Force and Lockdown Committee. We have finally finalized a list of questions for jail administration. I didn't want to send them out right before the meeting and you guys be like, oh my gosh, she expects me to answer these in this meeting. So it will come tomorrow, okay? But we have finalized a list of policies that we want to review and questions we have about the reporting mechanisms for use of force and lockdowns. We also set a date for just a standing monthly meeting. So we make sure it's a formalized hour set aside every single month where we're just talking about action items from the committee with enough time. We were thinking 2 weeks in advance of each meeting to make sure that any questions that come out of that meeting, we don't have to wait a whole month to get answers for it. And hopefully 2 weeks is enough time for you guys to be able to put that to any questions, any answers we have together. So that's what I got.
Thank
Thanks.
you. Warden's report.
So I want to just mention that I don't have very much to cover, but we did start 25 cadets last week. I think that's important to mention because I'm told that's the biggest class we've started since about 5 years. So we're pretty happy that, I don't know if that's, I don't know if it's too early to say that's a tide that's turning, but it's really good that we saw a class of 25 folks start as corrections officers. They're going to go through the training and then proceed from there. Along those same lines, we hired about 17 medical staff over the last couple of weeks. So we are having some pretty good luck. We're fortunate right now with applicants, which is good. That's not what I'm hearing from colleagues around the country. Everyone's struggling with hiring, but I think it's a good sign for Allegheny County that we had 25 folks start on the same day 2 weeks ago. That's a good sign. A lot of the issues we talk about in here, I think, can be categorized as leadership issues down there. So we're working hard. A few months ago, well, more than a few months ago, a gentleman was hired, Mr. McDermott, to look at leadership in the facility, to start a leadership academy, to start working on, cultivating future leaders, taking the current leaders and working with them. He has so far worked with about 46 managers down there. He's working through sessions with them to do just that, leadership development. And a lot of the issues that we've talked about in here, that the folks talk about with the public speaking, can be traced back to leadership. And I think it's really important that as that facility moves forward down there, that we've spent a lot of time focusing on our leaders and making sure that we're putting people in places of leadership, but then we're assisting them to become our future leaders, and that will filter down to everyone, the people who live there and the people who work there. So we're working on leadership. We sent a team of folks to another correctional facility last Friday. We're doing that every couple weeks. We're doing a lot of information sharing. We're doing a lot of visits to other correctional facilities to allow the folks at the ACGA to go out and see and network and learn about other housing units, about leadership, about unit management, and we're going to continue to do that. Since the last meeting, we mentioned about unit managers. I didn't say the names. I didn't talk about those promotions because they weren't official yet, but we did we did move Matthew O'Lean into the unit manager position of medical. We moved Captain Roundtree in a unit manager position for the juveniles, and we moved Ron Gross into the unit manager position for the segregation units. Also, I know a lot of you folks know Heather Greenwalt. She was a sergeant for a long time down there. She's now a captain, and she's going to be in the intake area. We're really excited about those 4 leadership changes. We're going to, work on getting the word out about the leadership that I mentioned. I had an opportunity, I got an invite from Director Dalton last week to talk about the state of human services in the county on a podcast. Went down and did that with her, and it was a good experience to talk about the changes we're making down there and how we believe the facility should move forward. We're going to start putting more information on our website about the changes in the facility, be a lot more transparent with social media, and last but certainly not least, I think I share with some of you, we just recently started an employee newsletter down there that's has been very popular, the first couple editions of that. We're going to continue to do that to information share and get word out to our employees about different opportunities that they can have within the facility. It's a big place. There's over 850, close to 850 employees down there, so we want to continue to improve our communications. I'd like to turn it over to Chief Estock. He's going to talk a little bit about some of the changes on the juvenile area.
Thank you, sir. Good evening, board. The first thing I'd like to say is I'm happy to announce that on April 7th, we'll be moving the juveniles from the current housing unit down to 6F. It's been painted down there. We're going to let the juveniles actually paint the cell color that they choose. So I'm really happy about that. It's pretty quick. Maintenance got on top of it, and we were able to move them, or we'll be able to move them down on Monday. Unit Manager Roundtree and Major of Unit Management Van Cherry visited Human Center. They talked with the people down there and what programming they're doing down there. And I think it was an eye-opening experience for them. We're looking at this school year possibly doing parent-teacher conferences down in education, having the parents come in and meet with the teacher and their loved one and kind of go over how school's going and seeing what kind of positive interactions going on down there. But yeah, I'm really happy with the progress of the juveniles right now, but I'm very much looking forward to bringing up a lot of new initiatives we're doing down there and programming. I think it'll be a very good place for them to be. Unfortunately, they have to be there, but we're going to make it the best we can do. I'm going to turn it over to Deputy Clerk.
Good evening. For chaplaincy and pre-release, on March 20th, the Foundation of Hope graduated one of its largest classes of Hope participants, a total of 22 graduates. The graduation ceremony, as always, included violinist Devin Arrington, who always comes in and plays for that, and one of our favorite guest speakers, Ken Aquilime. The Foundation of Hope is holding its fall volunteer training on April 26th, so anyone interested in volunteering should fill out the volunteer application on their website, foundationofhope.org. The judge really stole my fun on this, but that's okay. So we are, as everyone knows, the warden talked about starting a dog program at the jail, and we're very excited for that. We are collaborating with Animal Friends to indeed start that program. The program will bring dogs into the jail and partner them with 2 incarcerated handlers. Those handlers will be responsible for teaching the dogs basic commands that ultimately will make them more adoptable. The dogs will reside in the jail with the handlers. The handlers will be responsible for also the care and training of the dog. They'll submit documents on the dogs. They'll document the dog's progress in a journal. That journal eventually will go to the adopter, so they have additional information on the dog. Employees were encouraged to submit the name for the program, and as the judge said, that name is TAILS, which is Teaching Animals and Incarcerated Lifelong Skills. There's a lot of work that has to go in on the front end for this, so we're finalizing the procedures for the program, and we'll certainly be keeping the board updated as things progress. We had, in educational services, we had 10 students graduated from the creative writing program in the month of March. The program is looking to expand to offer reading events and additional summer programming that we haven't had in the past, so we're excited for that. On March 14th, Pittsburgh Hires Veterans concluded the Reentry Employment Skills Training class with 6 veterans who successfully completed the program. The course prepares individuals for that transition to employment through skill development, writing resumes, and learning how to establish and maintain professional relationships. A new cohort for that group will begin again tomorrow. So that concludes this month's report for programs. I'll pass it along to Deputy Martin.
Good evening, Board. Just a couple updates for you all. I am very happy to say that we have successfully started a methadone inductions on the week of March 18th. This project has been going on for quite some time between us, CTC, who came on contract with us last year, and DHS. Long time coming, excited it has happened. So in the 2 weeks that they have started inductions, they were able to complete 16 individuals to start methadone, but we have a total of 55 on methadone currently in the jail. The other program that we have been working on for quite some time is the Mobile Competency Restoration Team. They also started seeing clients that same week of March 18th, currently serving 2 patients that are awaiting transfer to Torrance Hospital. There are 2 more pending referrals for this team. The Mobile Competency Restoration Team works with patients who are deemed not competent to stand trial and likely to be restored. So referrals come from the BAU and clients who are court ordered into the program. And then lastly, last month we talked about our dental services, and I did confirm that we do fillings, but they offer exams, cleanings, fillings of cavities, and extractions. Criteria for the fillings are if a tooth is restorable and not in need of a root canal, then they will do a cavity filling. If the tooth is too far decayed, the option would then be an extraction. So that ends my report. Thank you.
Okay, we're moving on to questions of jail administration. I would like to request that each board member attempt to limit their questioning to a period of 10 minutes. I think that a lot of questions that are asked, the jail doesn't have the answer to. A lot of questions asked are based on information that hasn't been substantiated or corroborated. And I think it would be in everybody's best interest if those questions were asked via the liaison, via the committee. Let the jail get a complete and accurate answer instead of answering off the cuff while we're in this meeting. We do have a liaison, we do have active working committees now, and both of those sources can get answers to any questions without them being asked here. Okay, questions?
I just want to make a statement, Judge. Thank you for doing this quickly. If I have to leave during public comment, my wife is chairing Literacy Pittsburgh's charity event tonight, so I cannot be late for that. But my staffer, Encore, will be here, as he is at every meeting, to listen to public comment if I'm not still here for that. So just thank you.
Anybody else have any questions? Ms. Griffin?
Oh, just congratulations on the new programs. It's just really nice to hear, and I'm sure it's being celebrated by many people. I had a question about the TAILS program. I know residents read the Jail Oversight Board meetings, and one question that a resident might have is, how are the handlers going to be chosen? How would someone become a handler if they want to do that?
Sure, so this will take place on our program pod. We're going to start with our female program pod, and there is criteria for the program, so people that are interested will apply with our female pod coordinator, and then she will review the criteria, meet with them, explain the responsibilities, because this is not just a fun dog program. Taking care of an animal is a lot of responsibility. So she will review everything with them and make sure that they're in agreement. There's probably going to be more people that want to do it than dogs, at least initially. There will be a wait list. That is one of the challenges of having a dog training program in a jail environment, is that our population quickly turns over. So in addition to the identified handlers, there will be a wait list of handlers who will be able to join the program as people transition out of the jail.
Your Honor, I have a question. What is the criteria for a handler to take care of one of these dogs?
So I don't have the draft of the policy with me, but some of it is based on criminal history. Some of it is based on misconduct and behavior in the jail, what that person's classification is, things like that. So there's a few different qualifications.
Thank you.
Mr. Perkins?
Deputy Martin, I have a couple questions about the new program. So the Mobile Competency Restoration Unit, I think sometimes we talk about it because we work in this world and assume, an understanding of what that means. Can you explain a little bit about the goal of that program and how it's going to work?
So the team that come in, they're all hired through Centurion. They come in, they're still onboarding some of their staff, but there'll be peer support, there'll be nurses, there's a psychiatrist on board, social workers. There's a whole team of people that'll come in and work with the clients who are waiting to go to Torrance after they've been deemed non-competent. The whole goal is to get these folks to a less restrictive setting instead of going to Torrance. If they can restore them prior to needing to go to the state hospital, then that's what the goal is. They will also continue to follow up with their clients on the outside. So if they do get sent to a program, or even if they get released to the street, and even if they're homeless, there's places that they can follow up with folks on the street too.
My understanding is an attorney who's had clients, many clients who've been determined to be not competent. So without this program, then they remain incarcerated until there's a bed available for them at a mental health hospital, right?
Yep, and I can say we are, I know I don't read out our numbers anymore, but right now there's 14 on our wait list, and the longest waiting since February 12th. And honestly, I think that's one of the shortest wait times we've had in a while. But the goal is to get these folks moving prior than having to wait that long.
So rather than wait for a bed in Torrance Hospital, they would just be released if they're not, otherwise
they can get them restored.
ineligible. Okay. How many people do you anticipate working with at a time through this program?
It's going to roll out a lot more. They did a soft rollout this month. And like I said, they're still onboarding some of their team. So they don't have their full team working yet. Their goal is by the end of this month to have everything up and running fully.
Okay. And I really appreciate this program because I have seen clients who are charged with fairly low-level misdemeanor offenses and shouldn't be in prison because they're not competent. So this is a huge advantage. How many people work for Centurion through this program?
I honestly don't have the number off the top of my head.
Is it 1 or 2, or is it?
Oh, it's like, it might be up to 10. Like I said, that they have a full team of people that'll be coming in.
Okay. All right, thank you.
Ms. Hallam?
Saving the best for last. Okay. First of all, where do I want to start? Oh, the methadone induction. I literally had tears in my eyes when I heard about it. I am just so happy. It's like literally going to save lives. It's going to make people more comfortable while they're incarcerated. I just can't thank you enough for making that actually happen. If only you knew how many people before you sat in that seat and told me it was going to happen for years and years and years, and now it is. I'm just so excited about that. So thank you. Next thing, Warden, can we get added on to the jail newsletter distribution list? I would love to see it. And it's monthly, I'm guessing?
Would you like to appear in it?
I would love to appear in it. I actually would hope that pictures from my CO physical agility test could maybe appear in it. But truly, I would love to just be able to read it and know what's going on every month.
Yeah, we would just ask that there's no, it's electronic. We're not making copies and things like that.
Yeah.
Yeah.
So don't go and post it on Twitter.
Correct.
Right, but you wouldn't mind just sharing it with us for our information?
Yeah, I'll talk to the present judge. I'm sure we can send it.
Okay, that would be awesome. I would appreciate that. Next thing, where do I go? Okay, so I have a question about, you talked about the program pods, especially around the TAILS program. I do love the name. How's that? I do love the name of the dog program. I just know we've had issues in the past of people who just, because of classification, because of so many different reasons, are not, and I think that's what Sheriff Kraus was getting at a little bit with his question, is there are so many people who are excluded from participating in the program pods. Is there going to be any change to that now that there is new programming?
Not on who will live on the pod.
Okay.
But just because someone doesn't live on a program pod doesn't mean that they don't have access to programs. So we can't house minimum and maximum security individuals together. And that is typically what prevents those maximum security people from living on a program pod. But just because they live on a maximum security pod doesn't mean that they're not eligible for programs. So those people come down, they go to the reentry center, they participate in programming, they just can't live on that unit.
Okay, so that's about this program specifically, but what about so what is this qualifying? If somebody can be a max incarcerating individual and still have access to programming, what would make you not be able to have access to programming?
The only thing that would make you not eligible is if you were in the restricted housing unit.
That's it?
Yes.
So everyone else?
Or, excuse me, those who are on
AC status.
acute mental health.
Okay.
AC status, a lot, we'll packet them, we'll take up literature for them to work on and assignments, but other than acute mentally ill folks who are not at medically a stage to participate in programming, and those that are in RHU, everyone else is eligible.
Okay, cool. And is there any plans to have congregate programming where people move from multiple pods come together, whether it's, I know we've talked about religious services or.
Okay, so when I say a program pod, I just mean
Hope Pod, right?
Right, so there are people that live on that pod that are doing similar programming. Hope runs differently than all of our other programming. Hope runs on that pod. All of our other programming happens in the reentry center. So everybody comes down to class together. So minimum, medium, max, all in GED class, all in parenting class together. They just can't live together.
Okay, that is awesome news. It was not always that way, so I don't know when you
It's been
changed that.
15 years that's been happening.
Well, then I'm talking about something different, because there are definitely people who are told they're not eligible for programming who are not in RHU, DHU,
So during
or ACU.
COVID, there was definitely some different guidelines as far as who could come down. We have moved past and through that back to what it was pre-COVID.
Awesome, thank you. Yeah, I literally started on this board in 2020, so I'm not as familiar with pre-COVID.
Right,
Okay,
yep.
Thank you very much. I would also like to advocate for a additional Hope Pods. I know that is probably a funding and a staffing thing and all that, but just know I get so many requests from people, and I'm sure the people who run the Hope Pod do also, but I hope that that is just in the pipeline to expand to additional female Hope Pods, additional male Hope Pods?
The female program pod is a Hope-based pod, and it is just, in addition to that, it's women who go down to the reentry center. We have had some discussions on potential expansion of Hope programming specific to the maximum security population who aren't currently eligible for that program. That's the only program that they're not eligible for. And that will be, yes, budget funding, strategic planning around that, but we have had discussions about that.
Yeah, I have seen the success metrics of the Hope Pod, and if we had a dozen of them, I think we'd have really great outcomes. So just know that I am watching, and hopefully it doesn't take as long as methadone took, but I hope we can get that soon. Thank you. Next thing is, I know we've talked in the past about like the therapeutic counseling that was a result of the Howard consent order. How many therapists, Holly, maybe this is a question for you, how many therapeutic counselors do we have?
We currently have 7 working.
And are they county employees or are they contracted?
County.
County, okay. And do they do split shifts? Is it all 9 to 5?
They all work daily shift.
They all work daily
hours.
shift. Okay. Chief Deputy Estock, the new pod for the kids, really excited about that and want to see what you guys bring to make that happen. When you were meeting with the folks at Schumann, was there any conversation about like moving the kids out of the jail into Schumann, or is this new pod kind of mean that that's not ever going to happen?
No, we didn't have a conversation about that while we were down there at all.
Hopefully someday. But is there I can't really picture 6F. I don't know if that used to be a closed pod. It's not one that I'm super familiar with. But does it look like the current, where are they now, 7E?
No, it's the, the lower disciplinary unit, 6F. It has 3 pods on it. There's numerous areas for programming, we won't be doing the same separations.
That was really what my question was getting at, is what would segregation look like on this new kids pod?
It'll be more like the diversionary treatment unit. They'll have much bigger area. We're going to put a TV in there. It's going to have like a digital clock up on the wall. We're not treating them the same as a regular RHU person going in there. It'll be more like the DTU. The sanctions will be lessened. The unit manager will start from the very beginning of the segregation to kind of talk them through what happened. Do they recognize they were wrong? Would you talk to the person that maybe you got into a fight with? Kind of more that attitude towards it. And it may be a simple timeout for 3 hours as opposed to 30 days or something like that.
Okay. Yeah, I just know I've had some issues semi-recently, about kids who, because there's only the one pod, the kids who can't be around each other, they fight every time they see each other, and so then one ends up in lockdown all the time. So I was just wondering if this was set up differently than like that bubble pod, if there's plans for split rack.
The bubble pods on there are probably 4 to 5 times bigger.
Oh, great.
Than a bubble pod up on 7 Echo. So it's going to be a lot different.
It's not as much as a little like corner in the pod. Okay, cool. I'll be coming down very soon after April 7th to come and see that. I look forward to it. Speaking of DTU, I got some reports about folks getting strip search prior to rec. Is that like a policy that happens in the DTU?
On any segregation unit, they should be strip searched prior to coming out.
Okay, even though they're not leaving the pod and even though they're handcuffed to tables?
Only because we're concerned about any contraband they might have got a hold of, the safety of the other people that are out there, as well as the staff.
Okay, has there been any analysis of like that handcuffing to the table policy, or I'm just looking for some way to alleviate the burden that seems to exist I hear that from incarcerated individuals that they prefer the cages on 8E over the handcuffed to the table at DHU, because at least they have the freedom to move in that larger area. And so I was just wondering if that's a possibility in the future, or if you're evaluating that. I know it's a new pod.
So when DTU was built, obviously we had to make that in with all the settlement guidelines from the Howard case. So I actually talked to some of the nursing staff. Programming has been happening on that pod now. We have a psychologist that works on that pod. They see those folks all the time. Some of the feedback we're actually seeing, it has been both. We are seeing some folks saying that, you know, they'd rather be in a cage, and some of the guys are, as of today, we're saying, you know, it's kind of nice to just sit at a table and not see anything in front of us. So like, it's like a 50-50, you know, response that we're getting back for them, but do know that that was made in complete compliance with, you know, the settlement that we have to follow right now.
Yeah, I'm aware of that, and I'm happy about it. Like, I think it's great that we're not just lumping everybody together and putting them all on 8E.
Right.
I like that there's an alternative. I'm just hoping that it's like being, excuse me, constantly reevaluated as it's, because it's a new pod.
So we've, I mean, even as far as the tables, being handcuffed to the table is a part of the settlement, not like that's what the settlement says we have to do.
The settlement says you have to handcuff people to the table, okay.
And not use the cages. So like, that's what I mean, like DTU was built
For that
settlement. And now we can expand upon it and we can do things, but as of right now, we have to maintain handcuffing to the tables for rec and, you know, programming and all that stuff. Because of that, we are still working with a court-appointed monitor. We meet with her frequently, and she's just kind of getting in and seeing what we're doing. She's been here for visits. We we do have meetings with her, but, and she also said the same thing about, you know, being handcuffed to the table. However, that is what the settlement says we have to do.
Okay, I appreciate that response to that. And then the last question I have is about, is there any sort of tracking? I know we track lots of things in the jail. Is there any sort of tracking mechanism? I'm specifically looking for stats like we get in this warden's report about like vulnerable populations. So people with autism, people with ID, people with psychiatric disabilities, schizophrenia, bipolar disorder, PTSD. Like, do you, I would guess it would be healthcare, track those things? I'm also trying to track like people who are getting wound care, people who, you know, have heart disease. Is there actual tracking like numbers, or is it just each individual file would have that information?
So I mean, like if you want a wound care, like we can pull a report for wound care. We don't necessarily track, like I know how many people are on wound care, you know, but we don't necessarily track that in a spreadsheet because we can just pull those reports out of the system. There is a whole list of information that we have to track for the Howard settlement, you know, and a lot of it has to do with, well, you could read it in the settlement. Everything that they're requiring us to report out, that's what we're currently tracking in regards to mental health care right now.
So like you do know how many people in the jail have autism. That is something that you know. You
like
do
those are all
know
files that we can pull.
how many people have
We
ID.
also started the new screening process in intake, with, you know, with pre-arraignment diversion and like all those different screenings that we're now completing. So that tracking is newer, not as much information, but you know, yeah, there are ways that we can pull the information.
Okay, awesome. And then the last thing isn't a question, it's just a comment, because I did a visit recently and I have to do a report. It wasn't the day before the jail oversight board meeting because the judge asked me to stop doing that. But this is just a good thing, and I don't want it to pass because I never really get to like shout out awesome staff, and I am always complaining about the bad ones, but there are great staff members at the jail. And I want to specifically, there's an LPN named Crystal Wagner who, that woman that spoke earlier about her husband that was having a lot of health problems, he went out of his way to report to me that she went above and beyond to make sure he got the treatment he needed when he felt other people were ignoring him. So I want to shout her out. Sergeant Brinkley, who's at the entryway that we go in, Brickley, she's the best. She's like always excited that we're there, which usually doesn't happen for other jail staff members. And she is very helpful in making sure I know where to go. But especially at the last time I went, Sergeant Costello took me around. He was phenomenal as well. He was very helpful, very respectful. It was, I think, the first visit I have had in years where the person escorting me did not stand behind me and write down every single person's name that I talked to. And I know that that was a hang up in recent months. So I just wanted to make sure I didn't move on without shouting out some great things that have been happening. So, thank you.
Thank
Yeah.
you.
Oh, also, it is probably because Manny wasn't there on that one, but different conversation.
Manny.
Yeah, different conversation indeed. But, echoing what everybody's saying, of course, like we recognize the progress that's been made. I've been coming to JLB meetings since 2020, and, you have to give credit where it's due, and I'm really appreciative of the work that you all are doing. I'm really excited to hear about the changes being made to the juvenile pods. Correct me if I'm wrong, you said that they're going to be painting the cells themselves?
Yes, we're trying to get them to have a little bit of ownership of their cells. A lot of the times they'll peel off the paint and stuff like that, so if they choose the color, they're in the cell, they'll have a little bit of ownership of that cell, so yes, they'll be painting it.
No, that's good. I like that a lot. I'm a very strong believer in, colors and the effects that colors can have on you. So I think that's extremely important. I look forward to, seeing that whenever it's done. I also had the same question that Barbara had about how the handlers will be selected. And I know you said there's a criteria and, folks will get replaced as they move through from the waiting list. So another question is more of like a curiosity. Are the dogs going to be staying in the cells?
Yes. They'll stay in the cell with the handlers. There will be a dog crate in the cell. And, if the dog needs to go, well, most dog training programs want the dogs to be crate trained, so that will be part of the training process. But the dogs won't be in the crate all day. They'll be with their handlers, and if they choose and the handler chooses to, they could sleep in the same bunk. It's whatever the handler is comfortable with and the dog is receptive to.
Yeah, that's good. I know people love dogs. I know Bethany does not.
I'm allergic.
That comment, mind if I comment on that?
No, sure,
So
of course.
when I mentioned before about we're going out to other facilities the last few months, part of that is looking at their programs that they have that have been in place for years and years and years. Our last visit, we had a couple incarcerated individuals who've been raising dogs for 10 years, talked to all of our staff, because we understand that at DACJ, it's going to be a little of a transition for people to see a dog walking down the hallway who's not leaving and staying. One of the facilities that's doing this that we're really familiar with, and we've been talking to, about 50% of their dogs get adopted by the staff there, by the people who work there. So they've been doing it for years. We think it's pretty important for our partnership with Animal Partners, which is right here in Pittsburgh, to partner with them. I think a lot of the maybe trepidations that people have are, what is this going to look like? It's happening in a lot of other places that have been doing it for years and years and years, including not just dog training, but puppy training. So we're not there yet. But as the deputy said, there's a lot of criteria, a lot of work has gone into this to get us to this point. It's just a matter of getting to a place where it doesn't stand out. It just becomes commonplace, and our staff and the incarcerated folks it becomes commonplace at the facility.
I got you. Yeah, I truly think that'll have like a positive impact on people, morale, not just the incarcerated folks, but the staff as well. But, speaking of program, that is a program. I'm really, really excited to hear about, all of the programming that's available. I guess I just have like some clarifying questions, just so that we all, understand. I know the Hope Pod is a program, right? Is the DTU a program as well, or is that different?
So no, it's not a program.
Okay.
But they do programming
Okay.
on that pod.
Okay, I got you. And they do programming on the DTU, also the reentry services you mentioned?
The reentry services don't happen on the DTU pod, but it is services that happen through the mental health staff and other staff that go up there and work with them. But they're not going down to the reentry center. They're not doing the same programming that happens in the reentry center.
Reentry center. Okay, I got you. What programming is available to juveniles? I know like they have schooling, but is there anything else available to them?
they're in school all day, so they have a normal school schedule. In the evenings, we have done different programs with them. Most of those programs, they come, they run a course of 4 or 6 weeks, and then they end. A lot of our programs in the jail run on like a 6-week cycle, and then once it's done, it starts again. But the juvenile population tends to be with us longer than the rest of our population, so we don't run those courses over and over because that population's already had it. But I know Unit Manager Roundtree's been looking for a lot of different opportunities for engagement in the evening. The school is looking at after-school programming that's going to be offered to the juveniles, as well as additional recreation time to, get that energy out.
No, I appreciate that. I look forward to seeing that. When I went to school in the ACJ, that was one of the most positive experiences of my life, believe it or not.
They do. They look forward to school. The school has a great reward system in place for them to, earn points and treats, and there's a lot of positive reinforcement that happens in the school.
No, I appreciate that. You about to say something?
They're doing exercise programs in the morning prior to going to school. We'll start doing like cell inspections and stuff like that and see how they're doing, how they're reacting down there. In addition to that, Manager Roundtree's looking at other activities to do during the evening, a little bit more laid back than school would be, but kind of the same attitude. It'll be reward-based activities and a little bit more fun. Not that school's bad.
No, I'm really happy to hear that. I look forward to seeing how that plays out. I guess my last question is, how was the Eid feast? I wasn't able to make it this year.
It was great, and the food was so much better than last year.
Sorry I missed it, but no, I'm not going to tell you what I was doing. I don't want people to get jealous. All right, well, that's it. Thank you.
Judge Vashvik, before we move on, just a point of personal privilege, I just want to for the record note that Controller O'Connor left the meeting.
Okay, thank you. Public comment, Diana Hall. I don't take anything. But I don't take it. Encore takes it.
Diana Hull from Penn. As a volunteer with the League of Women Voters, I want to thank the jail administration and Connie Clark especially for her dedicated work in registering voters and making voting accessible at the jail. So thank you for that. Along with the positive changes already being implemented under Warden Wingard's direction, we at Penn are grateful for the improvements happening and the care of the people in the jail. So thank you both for making a difference.
Thank you. Sharon Bonavoglia. Okay. Oh, dear. Okay.
Thank you. It is with a heavy heart that I add another name to the list of the dead. With the new and improved leadership at the Allegheny County Jail, we at Penn are pleased to hear of the significant difference in how this death is being investigated. It is essential that the jail, this board, and the hospital that released this man back to the jail hours before his death take a very close look at why that happened, with an eye on how to ensure that residents of the jail are treated with the same respect, care, and concern as those with the best insurance money can buy. I appreciate greatly the transparency with the JOB over this death. We at Penn would also like to have as much transparency as possible with the public as his family will allow. And now, please rise for the reading of the names of the dead. Richard Lenhart, Robert Blake, Cody Still, Daniel Pastoric, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaw, Paul Spisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenek, Ronald Andrus, Anthony Tolada, William Spencer, James Washington, Damon Leroy Kays, Tim Menino, Douglas Bonomo, Zachary Som, Nicole Barufi, Richard Shuba II, Terrence Clowney, Tracy Hickey, and Justin McAuliffe. I'm Sharon Bonavolia with PIN, BONAVOGLIA.
Barbara Finch.
Good afternoon, Sister Barbara Finch. As a healthcare professional, I am very concerned about the nutrition in the jail. You get very many complaints about the food in the jail, and I'm not talking about it doesn't taste like mom's home cooking. We have to realize the reality of our residents that come to the jail, and many of them, majority of them, have chronic conditions. I have made this suggestion before. I think we should have a dietitian. It's striking on this report that we don't have a food service manager or a food service supervisor. And I know that there was issues about the food service. They would submit menus. I'm not talking about menus. I'm really talking about someone that would provide instruction on differences of trays for the condition that the person has. So I'm really encouraging us to look at that. And as always, I'm willing to pitch in and do whatever I can to assist that movement. But we really need to do that. We need to release our residents in better condition than when they come in. And they come from very poor situations to begin with. At least we can assist them temporarily before we release them. So thank you for considering it. Let's do it.
Lou Randall.
At present, it's Autism Awareness, Autism Acceptance Month, so I will be it up there. Yep, so Lou Randall, Autism Connection of PA. Hi. How you doing? I was able to get out to Schumann Highlands to do some autism training. It was really exciting. I was with Dr. Rebecca Griffiths, and so we start with everybody in the room, and they're there to do their usual job, and we're like, do you have any questions? They're like, nope, nope, nope. And then they stayed a half an hour longer at the end, which was great. And they're asking things like, can we tell by how they write, which is actually kind of true. They've got a kid who maybe can only do this. He's 15, uses like one colored crayon and can't do his alphabet. So they're really recognizing things. And I was kind of struck by the fact that they're talking about, not with names, but 2 individuals out of the handful of people that are there. There's not that many. So I think the incidence is really interesting to think about who matriculates up to the adult jail that just didn't have the kind of care and attention when they were kids. So that taught me a lot there. We had a lot of discussion because we're in the room. There's a lot of like metal doors, radios, beepers, all this stuff going off, and they start to go like, would that set them off? And we're like, yeah, that would. So they're identifying things. It was a really good training. I'm happy to come out and do any kind of discussion with anybody in the jail. The thing I sent around was a client of mine who was incarcerated for 9 years because he made a social error and talked to the police alone for a while. He spent 3 years at state at the DOC drawing his way out pretty much. And he wants to do a lot of advocacy for other people stuck behind, and what it's like to have a disability incarcerated, and what the environments could be like. He was in an autism unit for a while and then not, but he's got a lot of lived experience. I have a grant from the Pittsburgh Foundation to work with him. We're going to be doing some CLEs with Professor Rago at Duquesne in the fall, probably with One Hood. So some panel discussions, but we're both available to come out and do discussions. That piece I gave you is actually 22 by 30. He does these things one time in marker on poster board. It looks like it came out of a printer, but he thinks about like legislation, restorative justice practices, which what you're doing with the kids really, you know, that are there. Community corrections, the importance of these kind of communications and outreach across systems, just talking. So we're a resource. Happy to do that. I said, how do you feel about coming out in person? Because I don't want to put him back into a carceral environment. And he's like, I don't want to trigger that. But he said, it feels like kind of good to be under a magnifying glass because part of me glows, but part of me feels scorched. I was like, okay. Like he's really eloquent and great. So we're here for a resource. I hope people will take advantage of that anytime. Also, there was a request from Schumann Highlands or wherever about the sound and about the thing, since there's still construction happening, if we can jump in and do anything, even to like the $4, you know, light covers, that kind of stuff, because it keeps everybody calmer and reduces like conflict, that kind of stuff. My time is up. Thank you. Thanks.
John Kenstowitz.
John Kenstowitz. How are the organizational changes in our jail affecting our officers' identity of professionalism? There was a groundbreaking work in the HR field called Drive, published in 2009, which focused on the critical motivating factors in the workplace. The critical factors cited affecting motivation were a sense of autonomy, a sense of trust, a sense of purpose, and opportunities and potential for growth, as well as financial incentives. How does the structural changes at our jail that are taking place affect these three critical factors of motivation in the workplace beyond financial incentives? Our warden being in the blocks almost daily, listening to his staff and validating the importance of what they have to say changes the organizational dynamic present within our jail for years, which was a top-down, very authoritarian structure in which staff were always told what to do and administration knows best. By changing the power dynamic between the warden and his staff, a sense of autonomy can start to grow in which an officer's value and opinion is validated, and a sense of trust can start to develop. The officer actually has a say about the officer's future. To institute 3 mini wardens in the blocks, not wearing white shirts, increases in a very direct way how organizational problems the officer experience can be expedited, and the officer can concentrate on the role of why they are at the jail. This unveils the second critical motivational factor, sense of purpose. By clearing away organizational problems, the officer can reunite with the officer's sense of purpose and experience fulfillment in what the officer actually does. The officer can be a professional, providing security and opportunities for residents to participate in programs, be safe, and experience all the services they need to be in a better position upon leaving from when they came in. Contrary to some people's opinions, officers want to be professional, and their work is a profession in which they can grow, which brings us to our third critical factor, the sense of growth, and a growth in the officer's potential. The position of HR staff working in the blocks, depending upon the job description, can be a critical structural change, which can not only improve staff retention, but can excite an officer's opportunities for growth and even specialization. Establishing personnel goals focused on the officer's future, identifying officers with leadership potential, and identifying officers' continued need for training builds the officer's confidence and sense of security for not only for the officer, but also for the officer's family. A confidence about the future grows with potential for growth as a professional, which goes a long way in promoting staff retention. I'm out of time.
Thank you. Tim Stevens.
Good afternoon, and evening, I guess. Warden, it's my pleasure to meet you finally. I've been sitting around but not able to speak because of having to leave for other meetings. But I was here when you first introduced yourself. I was very impressed with your style, your apparent commitment to change. And it appears that that is beginning to occur in reality. I'll tell you what, it's good to see some smiling faces in this room because they were not smiling several months ago. And to the President Judge, I know it's difficult sometimes to sit through this, but keep sitting and keep being motivated that these changes are important for everybody to hear. John's comments are important in terms of the staff feeling like they are important and that they're listened to. Wanted to acknowledge one of our BPEP members, Sister Barb, in terms of the issue of food. I probably eat more than I used to, and I look forward to eating. And I'm sure the folks in the jails want to look forward to their next meal. And I think that's just a natural thing for all of us. And if we can, the idea of a dietitian, I think is an excellent idea, or at least someone that is having food supervisor history. We shared something that concerned me, that it appears, and Warden, I would like you personally to look into this, that at times it appears sometimes when a family member speaks at this microphone about what has happened to their loved one within the jail, sometimes that same loved one may have negative ramifications occur to him or her in the facility, and I'm sure you don't want to see that, hear it. You want to know about it, but I'm suggesting, as the chair of BPEP, the Black Political Empowerment Project, Coalition Against Violence facilitator, that anyone who does that should be severely disciplined, if not fired. They're not there to do that. They're there to respect the inmates or the facilitators, and not facilitators, but those who are incarcerated, that they be respected, and those who present problems, you need to know about that, and they should be actually supported and saluted for bringing that information forward and not punished in any way. That would be something that none of us should accept in any way. So that's it. My hope is, I'm excited about the changes in the children's facility. I think that's great. Colors are important. Decorations are important. And an atmosphere that's more positive is important to all of us at any age, particularly young people. Thank you.
Thank you.
Matt Jordan. No.
Hi, everyone. My name is Matt Jordan. I'm a community organizer at Casa San Jose. Warden, I wanted to thank you for your commitment to non-cooperation with ICE. And I just wanted to speak a little bit. I wanted to speak a little bit on what happened. Someone was abducted from the Renewal Center in March. And there was an error there, and it could have been addressed differently. So what I want to offer, Casa San Jose, we've done over 50 Know Your Rights trainings this year alone. Wow. And we would like to offer those same services to anyone who has access to a door, anyone who can let ICE into a building. And yeah, that's it. Thank you.
Thank you.
Judge Ivashevik, I just want to point out that we had agreed like many months ago that the non-agenda public comments, that the sheet would stay out there, and as long as you were there by the time those comments started, you would be able to speak. And for at least the past couple meetings now, I think it's been being taken early, and so I know there's at least one person who's in the audience who was here by 4:15 and it was already taken.
Okay,
Can I speak?
you. Who is it? Come on up.
There could be two.
Okay, now we're having one.
I know, but can we just, we agreed that the sheet would stay out there, and I know it gets keeps getting brought back early, so only one sheet should come up at the beginning.
Please identify yourself.
What's that, Judge?
Go ahead.
Sure. So what's supposed to happen is when we split the comments, member, into two, the ones about agenda items before the meeting, you have to be here by the beginning of the meeting for that one to speak about agenda items. So that comes over here at the beginning of the meeting. The second one for the end of the meeting comments is supposed to stay out in the hallway until public comments start, and it hasn't been. It's been being brought over before that, so.
Okay.
So people who were here.
I don't know that I recall that, but we can talk about it.
Yeah.
Go ahead, ma'am.
Great. It's Addie Lord, ADDY, last name's LORD. And I came here back in November to the November meeting and brought up a point about the jail's emergency operations plan, especially in light of hurricanes, but also now knowing that we have hailstorms and tornadoes that are a little bit more common. I just wanted to revisit that and make sure that it wasn't forgotten, especially with new leadership. And that's the main thing, is that I care a lot about all of my neighbors in the county. If we do experience some kind of climate emergency or weather emergency, that everyone is taken care of. And there are a lot of examples of incarcerated individuals not having any plan and being left in really dire conditions. So that is the main thing that I wanted to bring up today, is that the Jail Oversight Board has access to standard operating procedures or functional checklists, as well as any contractors or contracts that are being made with contractors include provisions around what they will do if they're responsible for incarcerated individuals. That's all I have. Thank you.
Thank you. Okay, motion to adjourn.
Motion to adjourn.
Second. Second. All in favor?
Aye.
I think.
I could, 1 minute. No?